All right.
Okay, I'd like to welcome everybody to our webinar. Um, Very fortunate this evening to have returning to us two of the three doctors here at FICTA, Endel and Elmer. We have Doctors Endel and Elmer here, and the idea is this is your opportunity to really ask them questions one-on-one. A lot of people have a lot of questions, so if yours are not answered this evening, there's two avenues to reach us. Obviously, you can call us. There's info@ficta.com. If you send a question to that, that'll be answered. But tonight, we're going to make an attempt for the next 30 minutes to answer questions for you. We appreciate you coming tonight. We also want to let you know that in the right-hand corner of your screen, there's a button that you can press, and it allows you to make an appointment for a consultation. And as a thank you or reward or thanks for coming tonight, you do evaluation for participating tonight. So with that, I'd like to give to Doctors Endel and Elmer, and I'm going to start with our first question. And just by way of introduction, between the two of these guys, lots and lots of surgeries, lots and lots of expertise, all three of them. And I'm going to direct the first question to Dr. Elmer. This is a question that comes up a lot, and people want to know, if I have dry eyes, can I still have the surgery done? So if you could discuss with us briefly LASIK and dryness.
Sure. It's a real common question, and actually want to be something that we are very attuned to checking. Keep in mind, we're ophthalmologists first. We don't just do laser surgery. So one of the most common things we treat is dry eyes on a day-to-day basis. Not just for lasers, just people coming into our office, especially actually this time of year right now because of the cold winter and the dry heat and lack of humidity in the air. Dry eyes been a big problem. So, if we couldn't treat people with dry eyes, we'd probably throw out half the people that walk through the door because dry eyes is so common. The biggest thing is diagnosing it. Come in. Some people don't even realize they have dry eyes. In fact, a lot of people think their eyes are wet because one of the side effects of dry eyes is their eyes will actually tear, and you think that your eyes are wet, not dry. So diagnosing it's important, and we do that a number of ways. Just asking the patient their symptoms, certainly looking under the microscope. We have special dyes we can put in the eyes. We actually can do analysis of the tear film as well to diagnose dry eyes. So not only that, the three MDs went to medical school first, so looking at your medical history, do you have any signs of things like thyroid disease that could be predispose you towards dry eyes? So we're going to look through all that. There's a lot of medications that are people on that could lead to dry eyes too. So just going over history first, asking questions to the patient, and then certainly look under the microscope doing diagnostic tests. Once we do that, then we're going to treat it. And there's many different ways to treat it. We often start with the most simple, just using artificial tears, moisturizers to make the eyes moist, just replacing the tears that you don't have. We often use little plugs. We can go over that, but we put a plug right in the tear duct here, and when the tears are made, they can't drain into the nose. And when that happens, your tears build up. It's like damming up a stream bed, and now there's more water. So it's very effective. We do that a lot. I bet you we probably do 1,000 a year, maybe more than that between us. Yeah, super common. And we, friends and family members, we plug them just because it's so great and it's reversible. So it's something we can do right in the office, literally in a matter of seconds, and typically covered by insurance. Other things, natural approach, Dr. Victor.
Say again?
Well, we were talking about natural approaches as well, like holistic ways to treat dryness, for example, taking fish oil or flaxseed oil orally by mouth, that can really help. And there's a prescription medicine called Restasis as well. Interestingly enough, Dr. Endel just became lead investigator, and I'm a sub-investigator on a new study. We're going to be looking at a new treatment to treat dry eyes as well because it's such a big problem. So the long and short of it is, go to medical school first so we learn about this stuff, okay? Be able to diagnose it and able to treat it. And what we would do is we always would treat dry eye prior to doing any laser surgery, okay? So that is first and foremost. So if we can treat it and then the symptoms are gone and we can see that your eyes are not dry under the microscope or we've reduced it greatly, then we can go ahead safely and proceed with laser surgery.
Perfect. Thank you. That's a very comprehensive answer. We appreciate it. This question is directed to Dr. Endel. And, we're always a little tentative about asking this question, but you're asking us, and we're happy to answer because we're very transparent. You want to know. And a lot of people say this to me personally all the time. can I actually go blind by having laser eye surgery? So, Dr. Endel, give us your take on that. Please.
Well, I can say over 40,000.
I'm having a little trouble hearing Dr. Endel. I don't know if anybody else is.
So, I just
And is anybody else having trouble hearing Dr. Endel speak?
what if it's the same
We have a tech person in the background in case we do.
Yeah. I can hear him just fine.
But I'm listening and I don't hear him. So, again, address the situation of blindness, please.
So, we've never had a patient go blind. And anytime you do surgery, this, I get it. However,
All right, I'm going to interrupt Dr. Endel for a moment here, just because I'm getting feedback both from the chat box and also getting feedback through a text message. I'm not hearing him call. So I don't know if it's because it's a directional mic or whatever.
I keep getting
So I've sent somebody out to actually join Dr. Endel. Maybe just scoot over.
Hi, Kevin. Dr. Endel's going to join you just to make it easier so you can hear him.
Grab a chair. Sure. Yeah, that's a good idea. We did this last time. We had an issue where his voice was not carrying through. You want to just go around and sit right here? That'd be awesome.
Well, sure.
Hello, Dr. Endel. Because it's important. I mean, this is an important, not to belittle, it's a very important question. A lot of people worry about blindness, so go ahead and address that, please.
So, sorry, I was trying to shout from the other room, but you have to put everything into a relative risk. And we have never, in over 40,000 patients, had a patient go blind or have any significant vision loss. Thankfully, 85% of the time, you see better than you did with your glasses and contacts, just not having to wear them anymore. And the other 15% are able to tie the glasses and contacts and not having to wear them. The biggest risk with any surgery is, could I get an infection? And if anyone's ever gotten an infection anywhere around the world and lost some vision, we should tell you that, of course, it's possible. You take your eye drops, one of which is an antibiotic, and you don't sit and do this for a couple of days, it's unlikely you even have any feeling of irritation, okay? Relative risk to put this into is when people wear contact lenses every day. That is a 3 to 4 times more likely risk of significant vision loss from an infection than you could ever have from laser surgery. So compared to most things we already do, laser is several orders of magnitude safer.
Very good answer. We appreciate the fact that you ask a lot of these very straightforward questions because, you know, because you're on a webinar, a lot of times people are a little embarrassed to ask us face-to-face, but these are important. If it's important to you, it's important to us. And sometimes the questions seem like they're a little bit simple, but no question is too simple. I just was asked by somebody via text message, and they said, can you describe, Dr. Elmer, what the laser feels like? Is there any pain associated with it? What does it actually feel like when you're underneath it? Please.
Yeah, it's a great question. So there's a couple of things that you're going to feel. First is just eye drops that you get. If you've ever been to the eye doctor before, the same eye drops. There is one that actually numbs the eye completely. That one burns literally just for a few seconds, and that's about it. Once the eye is numb, it's really numb. We can actually do cataract surgery under these numbing drops. So you can make incisions into the eyes with lasers or blades and have it really pain-free just by putting an eye drop in the eye. It's amazing how strong these drops are. In addition to that, depending on what procedure you have, if you feel a little pressure on the eye, I'll tell people it's a little like a firm handshake. We usually sort of demonstrate it for you so you know what you're going to feel. When we first got the laser, I had Dr. Fichter put it on my own eye so I know what it would feel like. I had eye drops put in my eye so I know what it would feel like so I can explain it to my patients. The laser, I've actually had my own laser, my eye lasered myself. However, I will tell you, there are times that we fire the laser, and I'll let laser right into the palm of my hand if I have to laser to recalibrate. And with no numbing medicines at all, you can stick your palm of your hand right under this laser and let it fire because it's so precise. It's just taking a very, very thin layer of tissue, so your skin is thicker than that. So it's just a little bit of a tickle is all. with no numbing medicine into the palm of your hand. All you feel is a little tickle. You really don't feel that on your eye because your eye's numb. So really the laser itself, you feel nothing, just enjoy the light show, and that's it.
You know, that's true. I can tell you from personally having it done that I didn't feel anything through the whole procedure. And that's a very honest answer, and a lot of people worry about that. And to that end, I'm going to ask Dr. Endel, who's sitting next to me, a question that just came through. And it's funny because it's relative to what's actually in the background behind us now. We have a gentleman, Michael, who wants to know, you know, besides LASIK, can lasers actually treat cataract? And it's interesting because tell them about that.
Sure. So yeah, that was a nice plant in the background here. So about 3 years ago, we were fortunate enough to be the first in all of Western New York to have a laser that can not only treat the surface of your eye, that clear dome on the front is called the cornea, but just on the inside of the eye, behind the colored portion, is a little lens. It's sort of the shape and size of an M&M can. And over years, like getting a wrinkle or a gray hair, this lens will get a little cloudy. And that's all a cataract is. It sounds like a disease. It sounds like something for 95-year-olds. And it starts happening typically in late 40s, early 50s with a little bit of extra glare when we're driving at night. Well, in the past, we needed to make very precise 2-millimeter incisions to go inside the eye, vacuum out that little cataract, and place these foldable lens implants in. Still a wonderful procedure, but now as technology moves ahead, you don't use your VCR so much. You start to move towards things like a Blu-ray or Apple TV or you know, just ordering up on Netflix. Well, technology in ophthalmology is moving even a little faster because we have lasers that can make all of the incisions for us. I tell my patients it's like a very good sous chef. All of the cuts are made. I just go in after the pre-incision, the cataract is pre-chopped, and I exchange the pre-cut cataract for a lens implant. What that provides to the patient is accuracy. Now patients after cataract surgery are approaching the level of what we've had in LASIK for years. 98% of our patients in LASIK can see 20/20 without glasses after the laser surgery on the front of the eye. If we can get the cataract surgery numbers up from the previous 70% into the 80s and 90s, it's the laser that's going to deliver it. So yes, the laser is a more precise way to do cataract surgery, and we've been doing it like that for 3 years, and fortunate enough to have doctors every month come and observe us to teach them in their own practices in other cities.
Sure, we just had a bunch of docs in just the other day to watch. To that end, I think, Dr. Elmer, if you could talk about the recovery time, because a lot of people are busy and it's hard for them to take that time off of work, and how long do they actually have to, you know, commit to having a procedure done? How long are they going to be off, and when can they go back to work? What are restrictions, etc.? Please address that, Paul.
So sure, it depends a little on what procedure we're talking about, but the basic procedure, LASIK, which is what we're talking about tonight, is making a flap of tissue on the cornea here, and the reason we do that is we use a laser or a blade to make that flap. When that flap goes down, all it is just a little paper-thin incision that has to heal that takes place in the 24 to 48 hours. That incision will heal. So most people are back to normal activities the next day. I mean, people go to work the next day, back to normal activities the next day. We ask you don't rub it, don't bump it, keep dirt and dust out of it, kind of be cautious for about a week. The second week you can do most things. We ask you not to do contact sports, swimming, maybe the next week. But honestly, as far as recovery time, very little. I mean, I tell people I work on Saturdays every other week, and they're like, "Are you crazy? Why do you work on Saturdays?" I'm like, "I love it." I mean, you see these people the next day, they're flying high, they're so happy, and makes me feel good to see the satisfaction, enjoy my job, and yeah, people are back to work and doing most activities the next day. Just be careful, don't rub it, don't bump it, keep dirt and dust out of it. That's about it.
Well, another big question, as Dr. Endel can address for you, is people want to know, you know, if I have this done, is it forever? What happens if I need a secondary procedure? Well, I need a secondary procedure. So talk about like the normal healing process and statistically how often we have to repeat it.
Sure. So again, the LASIK surgery is on that front portion of your eye, that clear dome. Well, it stops growing in most people between the ages of 18 to 20. Excuse me. And you might say, well, gee, every time I go for glasses, I get a new update in pair. Well, that little space between your face and the glasses sort of magnifies, excuse me, small changes that won't be affected by the laser. So when you have a laser procedure, we have over a 96% chance that it's a one-time thing for you and will last until you have some other aging changes on the inside of your eye, again, typically more 50s, 60s, and beyond. When you become 45, your distance vision will still be excellent, but like folks that never needed laser, you'll have that arm isn't long enough situation where you start to need some reading glasses, yet your distance is still very good for driving and what have you. So if you're a 20-year-old, a 30-year-old, a 40-year-old, I expect this to last until you get a cataract on the inside. Laser does not make that happen sooner or later. That's just whenever it's genetically in the cards. So our overall need to do a touch-up. You have a laser and, boy, we got you 95% of the way and you're pretty good, but certain nighttime driving's a little bit halo-y or not quite clear enough. Rare, but if you need a touch-up, we can go back and do that at no charge. We would never do it sooner than 3 months, though, because we have to give you enough time to heal. So it used to be 10 to 15% of patients needed laser touch-ups. Now it's less than 4%. Our number is as low as anywhere in the United States, we're happy to say. But everyone has to be followed so that we know you're safe.
Thank you. I'm very proud to say we have a very small enhancement rate because not only are they great doctors, but they have great technology. So given the past of what was used in the past, now the machines make it so that there's eye movements are taken care of. All the things that in the past could have been a problem are kind of taken out of the fold. Dr. Howard, talk to us a little bit about the whole idea about if you're nervous, if you come in here. A lot of guys, because guys don't go to the doctor that much, they don't use eye makeup, they don't have people touching their eyes. So talk to us about the aspect of like pure terror. I mean, you come in to have it done. What could you do to make the person not only feel better, but are there medications available? How do you keep them calm is the best way to ask.
So, that's something we're really proud of, actually. The surgery is awesome now, but we really have to tailor the surgery to the person. Our tagline's focused on you. So everybody comes to the door, what we're focused on is how to make it a good experience for the patient. We know the results are good. You just heard that. Our enhancement rate is very small. But how do we make it a good experience? And it's just that, Kevin, like you said. You make it a good experience for the patient. Get rid of their fear. There's no doubt the number one thing that keeps people from coming through that door is fear. Once they've had a friend had it done and they see it, or they come to a live open house, watch somebody have it done, then come talk about it right after to see their experience, some of that fear goes away. But how do we do that for you? Sitting there talking to you tonight, doing live open houses there, educating you about the procedure, having handouts available, stuff on our websites available for you. So educating you is number one. Number two, when you walk through the door, if you're still nervous, we can give you a little sedative, a little pill. We call it a happy pill. To be honest, probably only about 10% of our patients need it, because by the time they got to that point, we've already educated them enough where they know everybody's nervous. Some people say they're not, but they are. But so about 10% of our patients will give a little medicine, and then the real thing is once they walk through the door into the operating room, into the laser suite, it's at that point we use a lot of what we call verbal anesthesia. Verbal anesthesia is just trying to take your mind off what's going on. And it's kind of like people, like if you do things repetitively over and over again, you get good at it. Like if you know your dance steps, you can throw in a little extra step. So make sure the surgery is excellent first. That's the most important thing. Make sure you got good results. But once we know what we're doing and we have good results, we're really confident in what we're doing, at that point we can move to the next step, make it a good experience for the person, talk to them. We have a lot of techniques to try to make it comfortable for you, and probably Kevin can speak to that better than anybody, Kevin, because Kevin's in on almost all the surgeries because he insists us, all three docs, so he's been in on more surgeries than all three of us, and so he's just excellent at making the people feel at ease. It's actually kind of funny, Kevin, just to give you a little compliment. I mean, people come out and say, gee, thanks, Dr. Elmer, and good surgery, but can you thank Kevin for me and talking me through that surgery? And he's he's a joy to work with, and he makes the patients feel comfortable, and it's good to work with Kevin.
My job is to be in the room and make sure not only that the lasers are working and all that, as well as the other technicians like Kyle and Casey and Joyce and all the others. But what I try to do is I keep a dialogue going, because when I had it done, I wanted to know how long it was going to take. I wanted to know what they were doing. I wanted to make sure that, like Dr. Endel and I always laugh, when the room gets real quiet and you hear the footsteps running out of the room, you can panic a little bit. But if they keep talking to you and they tell you it's only 10 more seconds and it's only going to be this, it's the fear of the unknown. So, and Dr. Endel, talk about post-op. People want to know, how many visits do you have to come in for? I mean, some people feel like, I don't want to go there every day, but talk about the normal post-operative events.
Oh, great. It's important to know. We talked about when you come in the first time, an hour and a half to 2 hours, because we really want to know, with the dilated exam from front to back, we're doing no harm first. We want to make sure that your eye is healthy enough to have this outpatient elective surgery. And thank goodness, so most high percentage of the patients are. But after we sort of do the good carpenter work, as in we measure 3 times so that we only cut once, afterwards it's pretty simple. We see you the next day, then we see it the 1 week, and typically close to about 1 month. Right around 1 month for the LASIK procedure with the flap on the front of the eye, most folks are pretty well healed in as to where we expect they're going to be. If by that period you're less than perfect and you're feeling like you need a little bit more healing time, well, we might see you again in another month, what have you. But most folks, by 1 month, we can leave alone maybe all the way to the 1 year exam. We're happy to take you on as a new patient if you do not have your own private eye doctor, but you certainly are welcome and even encouraged to go back to your own eye doctor, as we're not in the business of stealing patients from other doctors. But we do full eye care, including pediatrics and, of course, eye diseases like diabetes, eye pressure. The other thing that's important to know is when you come into us, there isn't any sort of hidden fees or sort of bait and switch type of thing. In the past, there were sort of different things over the border where you maybe would go in at this price and said, oh, well, that's not for your prescription, then you're charged for each of your post-operative visits. Whatever our fee is when you come in, that includes all of your post-operative visits and visits to a year out.
Excellent. I know that in the chat box there are people asking questions, and we have one of our technicians by the name of Casey who's actually trying to address those questions, because, quite honestly, we get a lot. You can see what's happening on the screen, real-time, live, and she's trying to help us along that way, because it's difficult for the two guys here to kind of get through all the questions, and they're very good questions. I just want to take a moment just to remind you, one of the reasons why you're here tonight is to ask questions, but also as a reward for coming tonight, please don't hesitate to click on the button up at the top on the pop-in. So if you want to make an appointment or you want more information, please take advantage of that, because this is our way to connect with you, and we really appreciate it. I mean, we take the time because it's important to us, because it's important to you. So one of the questions that I laughed at, and I don't laugh because it's a funny question, because I do this, and people ask me this when I'm out in the neighborhood and out in the street, is, Dr. Elmer, talk about, people want to know, how do you keep the eyes open? I mean, when you're doing a procedure, how do you actually keep their eyes from wandering around the neighborhood and not closing and all the things like that? So talk about that a little bit, please.
It's funny. People ask that all the time. How does that happen? So the basically is we hold your eyelids open for you, and because we don't have eight hands, we have a little device. It's called a speculum, actually, that we can put in. A lot of people don't work like that word speculum, so we call it an eyelid holding device. Very technical term, but basically it's a little device that holds the lids. And you'd think your eye itself is numb, but the lids themselves are not. But it's gentle. It just feels like fingers holding the lids. And people actually will often say they feel like they're actually blinking when they're not, because it's numb. The other eye is blinking. So it's just a little device to hold the lids open, so you don't have to worry about blinking. It's comfortable. It really doesn't hurt. I've had it in my own eyes. People very rarely complain about the eyelid device. It just actually makes you feel comfortable that you don't have to worry that if you blink. The other thing, just keep in mind that with the modern technology, we're talking about low enhancement rates, but now the reason it's so low is because there's trackers on the lasers. When Dr. Endel and I first started doing this, and Dr. Fichte, before that, we were the trackers. We would hold your head still, and if you moved, we'd move your head with you. If you moved too fast, we'd let up on the foot pedal and say, stop moving so much. And we'd try to have you look at the light. Now, it'll track your eye. So it recognizes your iris, and once it recognizes it, it does an exact map of your eye. You can only laser you, no one else on the planet. It has to be your right eye. You can't switch spots with another person, and it'll lock on. Once it locks on, it'll track your eye, the engineers tell me, over 1,000 times per second. Nobody's moving that fast. So you can do the surgery, literally blink and then do it, because if you blink, the laser can't track it, will not fire. So we're holding your lids open, but it's super precise. I mean, you really don't have to worry so much about moving and blinking and that type of thing. It's not really a concern at this point.
Well, thank you. We're getting kind of towards the end, so just as a reminder, again, any of these questions that we didn't get a chance to answer for you, a couple things. We have an open house once a month where you can come in and physically attend and ask the questions that you'd like to know, and the doctors will stay till the cows come home to make sure they answer all the questions. And also, yeah, there's one coming up actually next week on Thursday in the evening. Refreshments, you get to see a live procedure. It's a very enjoyable experience. We've been doing them for years. The idea with that, too, is if you want to go to info@ficta.com, that helps. Don't forget to ask for a consultation. We have a refractive surgery coordinator who's excellent. Her name is Erin. She can answer questions for you. She just loves to answer questions because she's had this done herself, and she's had the unique experience of being through it that way. With only a few minutes left, I hate to do this to Dr. Endel, but it's important. Talk to us a little bit about the big word that people are afraid to ask. What's this cost? I mean, give us an idea. I mean, it's less than a swimming pool and more than a mouse. How much does this cost?
Sure. So what we typically recommend for patients, your eye health has reasonable safety to the thickness of the front and all of those maps we take. The all-laser LASIK procedure. We go ahead and create that flap on the front of the eye. And the reason we do that is because most patients that have the front staying intact, or the LASIK procedure, can see well enough to drive the next day. It heals faster, and it's the most comfortable. When we've eliminated the blades, and we have an all-laser procedure with the laser trackers, as Dr. Elmer had referred to, the two latest lasers on the planet we're happy to be in possession of. The only things that are allowed for the Top Gun pilots and the NASA astronauts. So we have that technology. My brother-in-law is an ophthalmologist in Southern California. You can have those two procedures for about close to twice to what we charge for it. I guess it's because it's across from a beach and everything's more expensive. So the most you would pay for any of the most custom procedures, not a later or more advanced laser in the world than what we can provide, is about $2,099 per eye. Now, many times 15% of that is covered by the insurance. When you come in for a consultation, our staff are experts at looking. And perhaps more important, we have the opportunity of the care credit. Well, that's the 2-year interest-free loan, and sometimes swallowing the fact that something might be $125 a month with no interest for 24 months is a little bit easier to think of than sometimes all of the cash at once. But when you look at what you spend on glasses or contacts, we have a little calculator on our webpage. Somewhere between 5 and 7 years, you've already spent that by what you're doing day to day. So if your relative put it in financial terms, the rest of that time would all be bonus because you're not doing it further. Once you have the laser, we don't expect you to need those glasses or contacts anymore.
Excellent. Well, in conclusion, I'd like to thank everybody for attending tonight.
Thank you.
Continually doing these every couple of weeks. So look on our webpage to see when the next one is. If you'd like to attend again, you're always welcome to jump in and join in. Give us a call, send us an email, send us a text message. Just get a hold of us. We do send information, as Kathy Otto did show. There's an envelope of information that's available. So request information, because in there's information about every aspect of this. So thank you again for attending. We look forward to seeing you in person, and it's our honor and privilege to help you. Thank you and good night.
Thanks for coming.